Good afternoon, good morning, and good evening. Welcome and thank you for joining us today from around the world and especially from Pakistan. I am Peter Lobo, and on behalf of the Aga Khan University, I'm delighted to welcome all of you to our Connecting AKU webinar series. This series is especially curated to share AKU's transformative work, research, new initiatives, and its finding new opportunities to make the world a better place during the pandemic and beyond. In today's webinar, Dr. Shahid Shafi, CEO of the Aga Khan University Hospital and a graduate of AKU's Medical College, Pakistan, will share his journey from Karachi to leading institutions in the US and now back in Pakistan, serving at his alma mater. Moderated by Ms. Munizae Jahangir, broadcast journalist and documentary filmmaker, I am sure very well known to many of you, we will explore Aga Khan University Hospital's patient welfare program and how the hospital aspires to treat all patients, be at the cutting edge of the research, and serve as a national asset for Pakistan. The session will run for 60 minutes. Ms. Jahangir will moderate a conversation with Dr. Shafi for about 40 minutes. And then we will all take questions from the audience. To ask a question, you can email connecting.webinars@aku.edu. Once again, that's connecting.webinars@aku.edu. Thank you very much. Over to you, Ms. Jahangir.
Good evening to some of you, good morning to some of you, and a very, very warm welcome. It is a great opportunity to be hosting this event. I have always, as a journalist, been speaking to the doctors at the Aga Khan University, and I think this year, in fact, last year, was a year where we all realized how important health is. We always knew that, but it really was, last year was where all the focus was on health. And I would like to add over here, because I was going through the Aga Khan University website, that it has an economic impact in Pakistan of more than $1 billion dollars of jobs, economic impact of more than $1 billion, and supports nearly 42,000 jobs. I thought that was fantastic. And I'm obviously very, very keen to know about the patient welfare program. I would like to welcome all of you and to introduce Dr. Shahid Shafi. He's a general trauma surgeon with over 32 years of experience in public, private, and academic healthcare systems. And he has graduated from AKU's Medical College in 1988. And then he subsequently completed an MPH from the Johns Hopkins University in 1991 in the United States, a residency, in general surgery from New Jersey Medical School in 1998, and a fellowship in trauma surgery and surgical critical care from University of Pennsylvania in 2003. And then a research fellowship from SUNY, which is SUNY. I don't know whether we call it Sunny Buffalo or is it SUNY, doctor can tell us, in 1997, and an MBA from Southern Methodist University in Dallas, Texas in 2017. And prior to joining AKU, he was market vice president for population health and chief medical officer for Common Spirit Health. And what is interesting about Dr. Shafi is that he has also dabbled in politics. He was elected to 2 terms as a city councilor in Southlake, Texas University, and he has served in leadership roles at the American College of Surgeons, American Association for the Surgery of Trauma, Eastern Association for the Surgery of Trauma, and Governor of Texas EMS and Trauma Advisory Council, amongst other national organizations. And what is interesting is that he's also published 110 manuscripts in peer-reviewed medical journals. So Dr. Shafi, thank you for joining us here, and a very, very warm welcome. Now, my first question is a very typical question that we ask from doctors who return from abroad, is that what brought you back to your alma mater?
Well, first of all, Munizae, thank you very much for that kind introduction, and I'm thrilled to be with you this evening on this webinar. What brought me to AKU what brought me back to Pakistan in very simple 3 letters is AKU. So the opportunity to serve as an institution like AKU is quite an honor and a privilege, and that's really what brought me back. And we can get into the details as we go along.
So really wasn't the food that you missed. It really was the Aga Khan University where you began your career. But tell us a little bit about Aga Khan University. Um, for example, how did that experience at the Aga Khan University impact your life?
Yeah, in many ways. So for most of you don't know this, but this is my third stint at AKU. So the first time I was at AKU was in the 80s when I was here as a medical student from 1983 in the inaugural class of the medical college. Graduated in 88, and then I stayed on to do an internship at AKU. And afterwards, I went to the US for further training. After completing my surgical training, I came back to AKU in 1999, and I was here for a little over 2 years. So that was the second time, and I was working as a junior faculty member in the Department of Surgery at AKU. And now this is the third time as a CEO. So it is quite an honor and a privilege to be associated with AKU for nearly 4 decades in different roles. So,
Well, that's a very long time. Decades is a very long time.
yes, it is. It is.
What? And do you have family here, and or did you bring back your family? Did you have your roots here in Karachi?
So my family is will be joining me. They are in Dallas right now. We have lived in Dallas for nearly 2 decades now. But the opportunity to serve at AKU was such a strong pull that they were all very supportive when I said, I would like to go to Karachi and serve there. So I'm very blessed to have my wife and 3 kids who were very supportive. In fact, yesterday was our 29th anniversary. So yes. So this is the first time I think we have been apart on our anniversary, but it is, she will be joining me in a few days.
Well, AKU is one of the organizations in Pakistan that we are very proud of. But I'm sure the audience also wants to know, what are your specific aspirations for the hospital that you're now going to be leading?
Well, I think a lot of it ties back to what impact AKU has had on me as an individual. So let me talk to you a little bit about how I have been impacted by AKU, and then I can talk about what I aspire to do in the next few years. So the first time I came to AKU was in September of 1983. I was 18, typical bright-eyed, bushy-tailed young person, and I had a lot more hair, and my hair was thicker and darker at that time. And when I came to AKU, my only goal was to become a surgeon, and AKU prepared me to become a surgeon. But what is more important is that my education at AKU opened my mind to the possibilities that I didn't even know existed until I joined here. It was at AKU where I learned the importance of public health, of health systems approach to healthcare problems. I learned the value of teamwork, learned the value of high quality education and research. And this is where I also learned about the importance of patient-centered care. And the education and the training that I received at AKU prepared me really well to compete and succeed at some of the highest ranking institutions at the US, such as the Johns Hopkins University and the University of Pennsylvania and other places. So the credit really goes to AKU for laying that foundation for my career that has been so successful. So what I aspire for AKU is really to continue the journey. Let me share an interesting fact about AKU. So yesterday only, in one of our alumni chat group, somebody shared a picture of His Highness Prince Karim Aga Khan, who's the Chancellor of AKU, at the ceremony of laying the foundation stone of AKU. And guess what the month was, the month and the year?
I don't know.
It was February 1971. So exactly 50 years ago, the foundation of this university was laid. And here we are 50 years later. And I can give you all the rundown on AKU, but what you're looking at is a university that didn't exist 50 years ago. And now it is a national asset for the country and has impacted not just the country, but the entire region and internationally all over the globe. So the impact of AKU has just been really
No, that's
tremendous.
true. I agree. So my question to you is, how is AKU any different from any other hospital, let's say in Karachi or Islamabad or Lahore?
So that's a very good question. So when I think about AKU and how is it different from any other healthcare institution in Pakistan or maybe elsewhere as well, so a couple of things come to mind. One is the impact AKU has had on training of healthcare workers. As some of our audience may know, that the first training program at AKU was the School of Nursing, which started in 1980. Then next came the Medical College, which started in 1983, and I was fortunate to be a part of that. And then came the internship programs, which started in 1988. And again, I was fortunate to be a part of that inaugural class of interns. And then the residency started, fellowship started. Then AKU also started the first Bachelor's of Science in Nursing program, the first Master of Science in Nursing program, the first family medicine residency in Pakistan, the first emergency medicine residency in Pakistan, the first institution to be accredited by Joint Commission International, the first institution in Pakistan to be accredited by the College of American Pathology, and so on and so forth. That really tells you the impact AKU has had on the training of healthcare professionals. So that's one thing that makes AKU unique. The other thing that I think makes AKU unique is the innovations that it has brought to Pakistan. And some of those innovations, we don't even think of them as innovations anymore. And I'll give you a couple of examples. In 1985, when the hospital started, one of the most innovative things that AKU adopted at that time was keeping medical records for patients. Up until then, that was not the practice in Pakistan. Nobody kept medical records. People went home with little prescriptions from their doctors and little purchase, and everybody had their own file at home of their records. So just at that time was an innovation, and now we take it for granted. The other innovation, again, I'm looking at the history, my historical lens of 4 decades at AKU, the importance of diagnostics. At that time, when AKU first started, people didn't pay much attention to the importance of labs and radiology and imaging to really arrive at a precise diagnosis. And AKU introduced that concept. The concept of residencies and a structured postgraduate training program to train specialists didn't exist, and AKU introduced that. AKU was the first one to create a whole network of labs and outreach center, which now exist in over 120 cities across all 4 provinces of Pakistan. That's an innovation. We also started a simulation center for training of nurses and medical students and doctors, so they no longer take their first shot at learning something on live patients. We have a simulation lab where they learn the basic skills before they ever touch the patient. So these are the kind of innovations that really make AKU unique.
The training for the nurses, is it just available in Karachi, or is it across
Yes.
Pakistan?
So the simulation center that is at AKU on its main Stadium Road campus, and it was established in 2015, and it is the first center in the US which has been accredited by the US Society for Simulation in Healthcare. And it is an amazing state-of-the-art place where you can learn so many different procedures, so many different clinical scenarios, and it's an integral part of our education program, both for medical college and the School of Nursing.
Mm-hmm. Well, if you compare it to the rest of Pakistan, especially in terms of training of nurses, do you
Mhm.
have something similar in the rest of Pakistan? I mean, I don't know very much about the health sector, but I have not heard of a training program for nurses. It's not that let's say common in Pakistan. It's in just very few cities.
Yes, so I can talk about AKU's program only. I will not be able to talk about other programs, but the first school that was established by AKU was the School of Nursing in 1980. And that was, again, the foresight and the forethought that was put into it because there was a shortage of well-trained nurses in Pakistan. So the reason the School of Nursing was started first was in anticipation of needing well-qualified, well-trained nurses when the hospital opened. So when the
Right.
hospital opened, these nurses were ready to start taking care of patients. And then, like I said, the first bachelor's in science program in nursing, the first master of science program in nursing, the first PhD program. So this is, and we also recently started a bachelor's program in midwifery. And we are
Right.
also starting a program in what's called nurse practitioners. So these are all higher and higher level of nursing practice that we are introducing in Pakistan. Again, very unique institution in Pakistan.
Right. Well, let's come now to the patient welfare program because that is something that everybody is keen to hear about. And there is a perception in Pakistan that good quality healthcare is
Yeah,
expensive. It's
yeah.
not. So, how are you going to provide good quality healthcare to people who may not be able to afford it? What is really the aim of the patient welfare program?
So let me start by saying that healthcare is expensive everywhere. So I've spent about 30 years in healthcare in the US, and healthcare is very expensive there. Healthcare is very expensive in every part of the world. What is
Not in
particularly
Canada or in England. I mean, but
uh,
there.
it is it is expensive. You just pay for it in taxes. You don't pay out of pocket, but you pay in taxes.
Fair enough.
So, so what is unique about Pakistan, different about Pakistan from Western world countries is well over 90% of our patients pay out of pocket.
Mhm.
So of course, it's a huge burden that is placed on the patients. So fortunately, AKU started a program for patient welfare very early on. Soon after the hospital started, opened in 1985, we established a patient welfare program. And what it does is the main goal of the program is to ensure that people who cannot afford healthcare have access to the highest quality healthcare that AKU provides. And for example, last year alone, we through our patient welfare program, we took care of nearly 1 million patients, and the welfare program spent nearly $20 million on patient welfare, which amounts to about 3 billion in Pakistani rupees.
Sorry,
The
this is
other,
in 1 year. Let me get this straight. This is an important number. Are
yes,
you 1 million patients in a year?
1 million patients in a year and about $20 million in spending on healthcare, on welfare of these patients. And these patients come from all over the country. Of course, majority of our patients are in Karachi, but if you will recall the extent of AKU's network, AKU now has 5 hospitals in Pakistan, including 4 besides the main campus in Karachi. We have 3 other hospitals in Karachi. We have another hospital in Hyderabad. We have nearly 300 lab and outreach center in 120 cities in all 4 provinces. And we take care of nearly 1.5 million patients a year.
Mhm,
In
mhm.
addition to the welfare program, which is provides the bulk of welfare, we also have a zakat system. We have a society which is a separate entity, which is called Behbood Society. And Behbood Society accepts zakat from anybody who wants to give it. And we really encourage people to think of AKU when they're thinking of giving zakat. And we have a separate mechanism to identify people who are eligible for zakat and are Sharia compliant in terms of their eligibility for zakat. And that fund is also, that spending is also increasing. I'll give you one example. Just about a month and a half ago, here's another innovation of AKU. AKU is the only institution in Pakistan that has performed two surgeries to separate conjoined twins. So I had the yes. So I had when I joined AKU in early December. Towards the end of December, our pediatric surgery team separated two twin boys who were conjoined at the chest and the abdomen, and it was a complex 8-hour surgery, and it was successful. And that surgery and all its pre-op and post-op care was provided was cared for by through our welfare program. Similarly, we also are the first institution in Pakistan to do gene therapy. Just a couple of weeks ago, we provided an IV infusion of a unique genetic treatment to a young child with a congenital disease, which is otherwise fatal. And this is the first time it has been done in Pakistan, and again, completely funded by AKU for all the local resources. So our welfare and zakat program is pretty extensive, and we are able to provide access to healthcare to a lot of people through that program.
I think one of the things one of the few hospitals in Pakistan who does it, you also do a TAVI for the heart. I believe, which only you do, and then there's another hospital in Islamabad that does it, and that's it.
If I sit here and start counting all the things that AKU was the first one to do, we'll be here for long past our time. But I will tell you one thing that when I was a student here, and then when I was here in my early career, and even now, there's one thing that is absolutely consistent about AKU that I've heard, that I've felt personally, I've experienced personally, and I've also heard from people. From the day it opened in '85, when I was here as a student, AKU has remained the hospital of first choice for many, many people, including myself, our families, our friends, our neighbors. And AKU is also the institution or the hospital of last resort, unfortunately. People come to us from all over the country when they have not been able to get the care that they needed. So AKU has this unique distinction of being everybody's hospital, either as a first choice or as a last resort. And that's really the value that AKU provides to people when they can really have this confidence that there is an institution in the country that can take care of them when it is needed the most.
But let me go back to the patient welfare program that you have. So when you say that you take care of 1 million patients, that means that 1 million patients get that treatment for free. I mean, do they have to not pay anything once they come in through the patient welfare program? And what is your criteria to select those patients? Is there a certain criteria?
Yeah. Yes. So there are criteria that patients and their families have to meet. Obviously, it is based on their need. It is based on their financial need and financial situation. Some people will get full welfare. Some will get partial welfare. So we try to match our resources with the needs of the patient. What is important to know is that our care does not change. Our providers, our doctors and nurses do not know who is on welfare and who is not on welfare. So our care remains the same, and this is a private matter. Whether a patient is on welfare is a private matter between the patient and their family and our administration. As far as their care is concerned, it's all decided by the physicians and their nurses, regardless of their ability to pay for it.
And where would you like to see this program in, let's say, 5, 10, maybe 20 years from now?
AKU is a national asset, and it is only going to grow. The way AKU has grown, again, with I keep going back to my 40-year lens. The first time I stepped on the campus of AKU, there was just one building all the way at the back, which was the School of Nursing. And today, when I entered AKU earlier in August, when I came here for a visit, the entire complex has like multiple buildings, and it's filled with the types of care that didn't even exist 20 years ago. So and if you ever come on campus and you walk around, you see how many people are here. So the needs are increasing as our population is growing, our healthcare needs are increasing. So we need to continue to grow it. We need to continue to grow our services. We need to continue to grow the welfare program. We need to continue to grow the Zakat program, which is the Behbood Society. And there are multiple ways people have participated in it. Some people give a one-time gift. Some people give an ongoing gift. Some people have given large chunks of money so we can create an endowment. For example, our class of alumni from the class of 88, in 2013, at our 25th anniversary of our graduation, the alumni got together and created an endowment fund worth $500,000, which is now being used for training and teaching and research at the university. So that's another way of giving back, and multiple alumni groups have done that. You can give as little as you want, and as much as you want. The need, that's the
So that's how the audience, we as people of Pakistan, that's how we can support AKU, by donating to the AKU fund.
Yes, so like I said, the need is just immense. I mean, we live in a country of 230 million people. The population of Karachi, the best estimate is 25 million people. So the need is just immense. So any kind of help that people can provide, that is appreciated, and it goes a very, very long distance. I will give you.
Let me add here that if the audience, all of them who are online, if they want to support AKU, they can visit giving.aku.edu for zakat and general patient welfare and any other area that you're interested in donating to. So, Dr. Shahid.
Yeah, I will tell you one other ways which people don't realize how AKU is different. Almost 2/3 of our students, medical college students, and a larger percentage of the nursing students receive financial assistance from the university.
Oh, I didn't know that. Really?
Yes, let me repeat that. More than 2/3 of the students who come to the medical college and a larger percentage of School of Nursing students receive financial assistance. Our admission process is what's called needs blind. It is purely based on merit. Once the person is accepted on merit, then we look at the finances, and if we have decided that they have the potential that we want to that would serve the country in the future, we'll make sure that the person will get their education through different financial assistance programs. So we are providing financial assistance not only to our patients but also to our students, both in medical school and nursing school.
Right. So, Doctor, when you do come and you lead an organization as dynamic as AKU, question is, you want to take it? I mean, the sky is the limit, really, isn't it? And I would like to say, coming from Lahore, we need an AKU in Lahore. And to be very honest with you, I mean, this is not because I'm on your webinar and I'm anchoring the webinar or hosting the webinar, but my father actually was very sick and he needed to have a heart surgery. And we were told that he should have a TAVI and not an open heart.
Yeah.
And we could not find a place to take him, not in Lahore. And after having the TAVI, I think it makes such a difference to his life, because if he had an open heart, he would not have been the same person as he is now. So I do think that the kind of service that you provide is needed not just in Sindh, but also, in Punjab, in Balochistan, I would say, in Khyber Pakhtunkhwa. So what's your big vision?
So if I had a magic wand, I would like to replicate AKU all over Pakistan, and also make sure that both for our education as well as our clinical program, and let's not forget that AKU is an academic medical center, so we also produce a lot of research, and let me share another fact with you. About 60% of medical research that comes out of Pakistan comes from AKU. We have an amazing faculty that is very curious, very innovative, very intelligent, and always asking the right questions. And that has led to some very unique findings. And they have worked in women and child health. We have worked on typhoid vaccines. We have worked on multiple clinical trials, and even and and polio research and multiple other research programs. So if I had a magic wand, yes, I would do all of that and some more. Like I said, the need is so large, but probably I would say, look, if you think about it, probably the most important impact that AKU has had is
Right.
is of course is obviously one obvious place is through the patients that we have taken care of. But I think the lasting impact of AQU is through the people it has trained. And we have AQU now has trained uh, nearly nearly 13,000 doctors and nurses and other allied health professionals. Our trainees, of course, are all over the hospitals and all over Pakistan.
So it's really
So
like a community, and you, in a way, are somebody who was a child of the AKU, returned back to the AKU
yeah.
to give back. I'm sure you inspire many people like yourselves. And tell us, are there a lot of people who actually go through the university and then come back, return to AKU like yourself as doctors?
Well, let me take a sip of water before I say that.
Yes, please do. I've been sipping water throughout this, so you must not feel conscious about it. Yeah.
No,
Okay. Okay, so you had a purpose for the sipping of the water.
I
All
had a
right.
purpose for that. Yes. So yes. So there are many alumni of Medical College, School of Nursing, and perhaps the most important impact that AKU alumni have had are the alumni of our residencies and fellowships. So if we look at if you go sheerly by number, so we have about 750 uh, 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 attending physicians in our faculty who are on in multiple specialties. Of those 750, there are probably 30 to 40 who are alumni of the medical college, but there are probably about half of them who are alumni of our residencies and fellowships. So that is the single largest group, and they have all trained at AKU, and they've trained at they were trained through these structured residency programs, which was again an innovation that AKU brought to Pakistan. Prior to AKU, the model of training was one of apprenticeship, where you would you would go work as a medical officer, and if you're lucky, you became senior medical officer or something else, and there was no really end to a training program. There was no structured training program. AKU brought the US model of a structured training program. For example, for surgical training, it's a 5-year training program where very structured, where you have graduated responsibility. So as you become more senior, you have more responsibility for patient care. So as we train graduates of all medical colleges from all across Pakistan, they come to AKU for training. Then a lot of them, some of them will be able to stay at AKU, but a lot of them, majority of them will go back to the cities that they came from and serve there. So that impact on human capital development is probably the biggest one. The other big impact that AKU has had is through women empowerment. Uh, more than more than half of our students are women. Uh,
That's very interesting.
yes, yes, yeah. That's another thing that people don't think about. But 66% of our alumni are women. 51% of our faculty are women. About if 40% of our of our workforce is women. About a third of our managers, in the middle management level are women. And about a third of our senior management positions are occupied by women. So women empowerment has been a huge contribution of AKU to Pakistani society. And I can't tell you how many times, I meet our nursing staff and our technical staff where the only reason this is the only place where they feel comfortable coming and working, them and their families.
That's
And
very
these,
interesting to hear. And
yeah,
we've got now some questions coming in from the audiences, but I'm going to squeeze another one.
sure.
Because during the corona because I anchor my own came out and useful information. Can you hear me, or you can
No,
hear
I lost you for a little bit. Can you
me?
repeat the question, please?
Well, during the coronavirus pandemic, and we're still going through it, we got a lot of very useful information from doctors at AKU. And I
Hmm.
wanted to know how specifically has AKU contributed during the pandemic and plans to continue to contribute.
Yeah. So we got through 40 minutes of talking without talking about COVID. So that's a great accomplishment by itself. But let's talk about COVID a little bit. Great day today. We received the first shipment of COVID-19 vaccine that arrived at AKU today, and of course, if the first phase, we will be immunizing healthcare workers. The government has designated 10 centers in the province of Sindh, and AKU is the only private institution that is one of those centers. So we'll be starting our immunization drive
The Sinopharm,
in
or is
this
it
is the
act-
this is Sinopharm. This is Sinopharm, the Chinese vaccine. So that's obviously a contribution that AKU has. But going back to the onset of pandemic, AKU, so number one, direct patient care. So we very rapidly created an area of the hospital where we were able to isolate that area completely and convert it into a COVID unit to create a safe space and a contained space both for the patient and our healthcare workers, and also to continue to be able to protect our other patients who are coming there for non-COVID treatment. So that's one thing that we did. We also offered several training programs and educational programs for other institutions related to COVID. Our lab also started COVID testing very early on, and that number has continued to go up. We have also entered into partnership with the government to provide teleconsult facilities for other public and private hospitals, also telemedicine facilities for intensive care units in other hospitals. And of course, the education programs that we continue to put out about different aspects of COVID-19 treatment. So there were multiple ways that we have helped with the treatment of COVID pandemic.
Well, there's another question for you. It's a rather long question. I'm going to shorten it. But basically, it asks you that there is a limit to the impact we can do as an institution. And you mentioned how AKU is a national asset. How do you think you can expand the role of AKU as the national asset? And unlike the government, other institutions for the greater good of the community. And I think you answered partly some of that. But I'd also like to ask you, what are the challenges of medical practitioners in Pakistan? You know, you worked in America, you worked here. Everybody tells me we don't do any research and we spend more money on buying weapons and less on healthcare. So,
So, I can only talk about uh, I can only talk about my experiences and my perspective. So so the question is that how do we, let me think about this. How do you expand AKU's capabilities beyond AKU? So I think the two ways
mhm.
that we do that, and one is the one that I've already talked about, is one is through training and education. So that has had a huge impact all across the country. Like I said, the trainees, The graduates, the alumni of our fellowships and residencies are working all over Pakistan, and we have a great network, and they're providing very high quality care with the resources, limited resources that they have. The second impact, probably the biggest impact we've had is as a role model. Again, we have been pioneers in, for example, maintaining adequate medical records through women empowerment. Number three, through bringing in new technology which is relevant to the local population. Number four, the idea, for example, of having a formulary. So our institution, AKU, does not use just any medication that is available in the market. We have a very robust process of evaluating the medications and drugs that are available in the market, and then selecting the ones that are the safest and the best available in the market through this formulary process. We never dispense medication without a physician prescription. So these are the kind of things that help us be a role model to other places. And quite frankly, a lot of other hospitals and other institutions in the country have adopted the practices. Our nurses are practicing all over the country. Our people who have worked in, for example, our pharmacy, our physiotherapy, our management, they're working all over the country, and that's another impact. That's how you expand your influence. One of the things that I've learned again in my personal life as well is that there's certain impact that every individual or every organization has directly, but the larger impact that you have is by inspiring others. So I like to think that AKU has inspired a lot of other institutions to achieve for that excellence. And it has also shown our patients what they should expect, what good care looks like, what's compassionate care looks like. What does it mean to be patient-centered? What does it mean to be caring for the families and provide compassionate and empathetic care? So by providing that role model is another way to have an impact.
I hate to bring you back to COVID-19, but I have to ask you this question because it's being asked by somebody who sent me a message who's watching this and said, please ask them. Because recently, Dr. Faisal, who's the advisor to the Prime Minister on health, made a statement. He said that the Chinese vaccine is not advisable for women who are pregnant or for people above the age of 60. Is that correct?
So I'm going to have to message Dr. Faisal to ask him that question. So I can do that if you give me some time, but I will not give any medical advice on this webinar. I'm simply a surgeon and a CEO.
Okay. So fair enough. That was an unfair question, but anyway, people are very obsessed with COVID-19 as they should be.
Absolutely.
Because
no, that's a good question, and we are preparing and we are putting out a lot of these kinds of questions. We are putting information out as soon as we learn them. The issue of Sinopharm not recommended for people over 60 is a concern, and we are going to stick to all the guidelines that are provided by not just the manufacturer but also what we have learned through clinical trials.
Now, coming back to AKU, one of the questions that the audience is asking is, what are the future plans for the medical college of AKU?
Well, you are asking me to predict the future, and predictions are fraught with problems. But here is what
I'm not the audience the future. Yes.
Okay, so but here is again, it's again with my 40-year perspective or 4 decades of perspective. Here is what I know, what I've seen, and which should give you some idea of where we might be in the future. When I joined AKU, there were only 50 students who were accepted. By the way, out of an applicant pool of over 1,100, so it was highly competitive. We did not, at that time, we did not have a hospital. We did not have any residency programs. We did not have any fellowship programs. Each department had probably no more than 3 faculty members. Today, we graduating about 100 medical students a year. Our faculty is about 750 people in multiple different specialties and all areas of basic and clinical sciences. We have, in addition to the MBBS degree, we also offer master's programs in public health, in health policy and management, and in multiple other programs. We also have training programs for allied health professionals. So the sky is the limit. The sky is the limit. But this is what I will say, that our focus will always remain on quality. It's not about quantity, it's about quality. I think a few high quality trainees will have a much larger impact than a large number of mediocrely trained people. So our emphasis will always be on quality, not on quantity.
All right. Well, I have another question from the audience, and this has come twice. Did you ever think of becoming the CEO when you were a med student at AKU?
Um, the honest answer is, uh, like I said, when I joined AKU, my goal was to become a surgeon, and AKU helped me achieve that goal. But once I got to AKU, one of the unique things about AKU's curriculum is the emphasis that it places on what we call community health sciences, which is all about public health, community health, health policy, health systems. And once I was immersed in those kind of studies, I realized that uh, to have the biggest impact, you need to have teams of people. You need to have systems in place. You need
You're
to
right.
have institutions, and that's how you have an impact. So about 5 years ago, so I worked as a surgeon in the US for many years, and then about a decade ago, I had my first important management position, and then I sort of rose through the ranks. And about 6 years ago, I took a conscious decision that I will spend time, energy, and some of some some of my mental strength on learning new skills. So at the age of 50, I went back to school, and I
Really?
did an yes, and I did an MBA from Southern Methodist University, and again that was to prepare me for management roles, and that quest for learning was another thing that I learned at AKU. The quest for lifelong learning, that was another trait that I learned at AKU.
Mm-hmm.
So that brought me, so that additional training and degree then helped me you know proceed in my career. Like you said, I was the chief medical officer for a statewide health system in the US, and then that gave me the opportunity to come and assume this role in CEO. And what an amazing opportunity! I mean, I feel so blessed and so honored and so privileged to have this opportunity. That's the impact that AKU has had on me. If I think about it, besides giving me education and training and the foundation, what AKU has done for me is give me opportunities. It took a chance on me in 1983 when I applied for the medical college. It took a chance on me again when I wanted to come back as a young faculty, and it has taken a chance on me again in this role. So what an amazing
I'm sure
legacy.
not a chance this time around. I'm sure that they have a lot of hopes tied in with you, and I can see that you have this kind of inspirational role here. But not just that, I think your heart is in it, and when your heart is in it, I don't think you can really go wrong. Well, another question from the audience, and it is that during the discussion, you talked about the nurse practitioner program to
Mhm.
be initiated in the AKU. I thought you already had it, but maybe I'm wrong. Can you please elaborate over the details of the program?
So the I will tell you about the program in a minute. So you're asking about the nurse practitioner program. I'll tell you a little bit about it, but it reminded me of another interesting fact about AKU. So I'll share that with you first.
Hmm.
Actually, two facts. So one is that on AKU, if you look at AKU's Karachi campus, it has four leaders: the CEO of the hospital, the dean of the medical college, the dean of the School of Nursing, and the dean of the Faculty of Arts and Sciences. For the first time in the university's 40-year history, all
Hmm.
four
Hmm.
are alumni of the institution.
Now that's fantastic. That says a lot about the institution.
It's
That
it's
says
a
a lot.
yeah. it's a milestone in any institution. It's a historic milestone in AKU's history. The nurse practitioner program is a better description is actually advanced practice nurses. And these are nurses who are able to do a lot, who are trained to do a lot of routine healthcare stuff. And they work as physician extenders. So there are certain skills that they acquire through a very rigorous training program that enables them to work still under the direction of physicians, but they're doing a uh, lot more hands-on patient care work as physician extenders. The and we are still in the process of developing that program. Again, that's an innovation that we are bringing to Pakistan. It does not exist in the US. The advanced practice nurses, they work in all specialties. You see them in primary care, you see them in the operating room, you see them in oncology, and every specialty. These advanced practice nurses play a huge and tremendous role in providing access and extending our workforce. So that's the goal of our program.
Mm-hmm. All right. Well, thank you for that very detailed answer. We have a very interesting question for you. And it is, being young and inexperienced, I would like to know, this is not a trivial question, on balancing academic ambitions and desire for social change. How has he balanced, compromised on, and combined these goals to achieve satisfaction in his academic work as well as contributing to society, especially Pakistan society? Can you hear me?
So
Did you
Munizae,
get that question?
no, I lost you in the beginning. So can you repeat that question, please?
So the question is, Dr. Shafi's, we would like to know Dr. Shafi's thoughts on balancing one's personal academic ambitions and one's desire to enact social change. How has he balanced, compromised on, and combined these goals to achieve satisfaction in his academic career?
So that's a difficult question to answer, because quite simply, I feel very blessed to be able to pursue my passions. So when I was younger, I really wanted to become a surgeon, and I did become a surgeon. And it was just an amazing experience to be a surgeon, to be able to cure disease with with the skills that you have been given. Uh, the academic pursuit, I was, for 10 years, I was in pure academic practice at University of Pennsylvania, and then University of Texas, UT Southwestern. The curiosity of mind, I was able to learn through research. My focus was really on improving quality of surgical care, and how do you measure it, how do you report it, how do you improve it. How do you balance all that? It's a difficult question to answer, and perhaps my wife might be better able to answer that question, if I've been able to balance or not. But we have, three wonderful kids, and they all seem to be doing well. And my wife and I have celebrated our 29th anniversary yesterday,
So it's
so
all
I must have balanced it somehow.
all right. So we'll save that question for your wife, but there's a very good question. I wish that we'd had it earlier. It
Yeah.
asks you, how does AKU address ethical issues in its processes, clinical and non-clinical? And
Uh,
that's an
ec- yeah, excellent question. So the issue of medical ethics is another innovation that AKU brought to Pakistan. So very early on in AKU's history, we had some faculty members who realized the importance of ethics in medicine. So the way that we are structured now, we have a full complement of physician faculty members who are experts in ethics in medicine. If we have any ethical issues, we refer the patients or the clinical scenario to them, and then they have the opportunity to review the entire situation and give the best advice to us. In fact, one of our former faculty members, who was also the associate dean of our postgraduate medical education, now leads the Center for Ethics at one of the other leading institutions in Pakistan. But that's the innovation that we have brought here. So uh, our emphasis on providing ethical care and making those difficult decisions has our 100% commitment at all times.
Well, thank you very much, Dr. Shafi, for this very informative webinar, and it was very inspirational. I did not know that AKU had so many facets to it. And I would like to take this opportunity to thank the audience, thank the donors who have kept AKU alive. Without their contribution, I suppose an institution like this could not have survived. And I would just like to say that in Pakistan, it's so difficult to build institutions, because here it's not just hard work and perseverance, but it's blood, sweat, tears, emotion, heart that goes into it. It's a great organization. I hope people come forward and continue to support it, because there could not be a better cause, there could not be a better institution. And I love the fact that you believe in women emancipation. So, um, best of luck to you. And I really hope that it grows in the way that you have envisioned. And the rest of us, the audience, we can support it by donating to aku.edu, and there are all your website is it's all the addresses are there. Thank you so much for everyone who joined on this webinar, and good evening, good morning, good afternoon. Thank you so much. Goodbye.
Thank you, Munizae. Goodbye.